Today, let's talk about impact of diabetes mellitus on benefit of beta blocker therapy after myocardial infarction. Beta blockers are uniformly recommended for all patients after myocardial infarction, including those with diabetes mellitus. The study assessed the impact of beta blocker type and dosing on survival in patients with diabetes mellitus after myocardial infarction. Coming to the methods, a cohort of 6,682 patients in the outcomes of beta blocker therapy after myocardial infarction were discharged after MI. In this cohort, 2,137 patients had diabetes mellitus. Beta blocker dose was indexed to the target daily dose used in randomized clinical trials and reported as percentage. Dosage groups were no beta blocker greater than 0% to 12.5%, 12.5% to 25%, 25% to 50%, and greater than 50% of the target dose. The overall mean discharge beta blocker dose in patients with diabetes mellitus was 42.7 plus or minus 34.1% versus 35.9 plus or minus 27.4% in patients without diabetes mellitus. Coming to the results, patients with diabetes mellitus were prescribed carvedilol at a higher rate than those without diabetes mellitus. The 3-year mortality estimates were 24.4% and 12.8% for patient with diabetes mellitus versus without diabetes mellitus, respectively, with an unadjusted hazard ratio. Patients with diabetes mellitus in the greater than 12.5 to 25% dose category had the highest survival rates, whereas patients in the greater than 50% dose had the lowest survival rate among patients discharged on beta blockers. In the multivariable analysis among patients with diabetes mellitus after myocardial infarction, all beta blocker dose categories demonstrated lower mortality than no therapy. However, only the greater than 12.5% to 25% dose had a statistically significant hazard ratio. In patients with diabetes mellitus, there was no statistically significant difference in 3-year mortality among those treated with metoprolol versus carvedilol. To conclude, the analysis in patients with diabetes mellitus and myocardial infarction suggested a survival benefit from beta blocker therapy with no apparent advantage to high versus low dose beta blocker therapy. Although physicians tend to prescribe higher doses in patients with diabetes mellitus, there was no survival benefit for carvedilol over metoprolol in patients with diabetes mellitus.